Hi, everyone, and welcome to a new course from One Word Anchor, Diseases and Epidemiology, taught by me, Sophia Jiang. I'm currently a rising senior at Bergen County Academies in New Jersey, and I'm in the medical academy, so this topic is something that has always fascinated me, like diseases, how they spread, and especially the study of them, which is what epidemiology is. But that's kind of a sort of basic definition for epidemiology, so we're going to define it very strictly for our first class today. So let's start off. Definition set by the CDC is that it's the study of the distribution and determinants of health-related states or events in specified populations, and the application of the study to the control of health problems. Now, there's some words here that I have bolded and highlighted, and these are certain topics and certain keywords that we're going to talk about because they'll really bring together our whole understanding of epidemiology. We can also take a look by taking the word apart. So, epidemiology, we can separate epi, which means upon, demi, which means people, and ology or logy is just like study of. So it's like the whole study of people. So if that gives you any indication of what it is or some more profound understanding about it, well, there you go. Well, let's jump into our first word though, study. So epidemiology, as in like all scientific studies, it's data driven. It's this systematic and unbiased approach to the collection, analysis, and interpretation of data. Now, what can this data be? Well, it could just be a number of things. It can be, oh, how many people got sick within a certain range of time? Like, how old are the people who got sick? What is their age range? Like, just different types of sort of data points. And this could be anything. And once you collected, analyzed, and interpreted this data, you can find something such as, oh, the number of cases of disease in a particular area during a particular time period, if they are abnormal, because as soon as these data points start becoming abnormal, that's when you know you might be dealing with an epidemic, a pandemic, some words that might sound like a little bit familiar for now, but we'll go into it later. So what's more about the study is when you're thinking about data is there's so many types of data. So we can split them basically into the 5 W's. These 5 W's, who, what, where, when, and why. So when you're doing a epidemiological study, you have to ask who is being infected or how many, like depending on a person or a group of people. You have to ask like what is the disease that we're working with? What is the health event that we're working with? Got to ask where. In this place, in that place, all around the world, only in the US, where? And we also have to ask when, because we have to set things within a certain time frame. Is this like over 10 years? Is this over 1 year? Because those 10 years and 1 year is a huge time difference. And if we really want to make careful observations about that, we have to set everything into context. And that leaves our last W, why. So this is the causes, the risk factors, the modes of transmission, just saying, why is this health event? Why is this disease present? Why are the data points shown to be abnormal? And this is mostly from the analysis part of epidemiology. But once again, it's all data. So now let's move on to distribution. Now, distribution is like part of like the data that we've been talking about, and it's split into two sections. It's split into the frequency and the pattern. Now, the frequency is the number of health events. It is the relationship between that number to the size of the population. For example, we can say, oh, 10 people have gotten sick. But we have to say, oh, is that 10 people a significant number in the whole population? Say that you're looking at a daycare, right? And these are 10 children out of 20 children who've gotten sick. And you're like, oh, so the frequency is 1 out of 2 people, 1 out of 2 children in this daycare. And you might say, yes, that's abnormal. But if you're saying like 10 people as compared to like 10 million people, then you're really saying, oh, the frequency is pretty low. And it might not be worth going into it that deep because the frequency is that low. So it would be considered abnormal. And the other section is pattern. So pattern is the occurrence of health-related events by time, place, and person. And if you think about it again, time, place, and person, those are just 3 of our 5 W's. It's the who, it's the when, and it's the where. So characterizing these time, place, and person are all activities of descriptive epidemiology. And we'll go into this a bit later as well, because, epidemiology is such a broad umbrella. So there's descriptive epidemiology, analytical, but of course, all things we'll talk about later. But for now, just keep in mind that time, place, and person are descriptive epidemiology, mostly because, yes, it is describing what is going on. And now determinants. So determinants might be a new word that you're not familiar with. What it is basically is any factor. It could be an event, a characteristic, or anything really that brings about a change in a health condition or another defined characteristic. So this is based on the assumption that illnesses do not occur randomly in the population. Let's say, for example, that you get sick. So you don't just say, oh, I randomly got sick. You say, if it's like the flu or it's like the cold, or if it's a cough, you're like, oh, the flu, I must have caught it from someone else. If it's a cold, you might have been like, oh, it was too cold the other day and I didn't wear my jacket. It does not occur randomly. And once you identify what exactly caused it, what factor caused it, say it was, oh, you caught it from a classmate or you forgot your jacket, this identification can direct effective public health control. So the government might be like, oh, when you're at school and there's a lot of cases going around, be careful. Like wash your hands, use sanitizer. Or like when you go outside and it's cold, wear a jacket. Something simple like that. So epidemiologists, they assess whether groups with different rates of disease differ in their demographic, genetic behaviors, and other risk factors. Because the risk factor for getting a disease when you're much younger, it might be different from like the risk of getting disease when you're much older, because age is a determinant. So, but let's really define what health-related states or events is, because sometimes I avoid using the word disease and replace it with health-related states because a disease is not broad enough to cover all of the things that humans go through. So instead we use health-related states. So a health-related state is anything that affects the well-being of a population. It could be communicable diseases like COVID, it could be the flu, or it also could be non-communicable diseases like chronic illnesses, injuries, birth defects, like maternal child health, occupational health, environmental health. Because even though these are diseases, sometimes if you use diseases, people might not think of an injury as a disease. So you would use health-related states. And next we have specified populations. So there's always going to be a difference between what epidemiologists are working with and what healthcare providers are working with. So healthcare providers are just, say, your doctor, your pediatrician, like anybody in a hospital, a nurse. And epidemiologists are those who use epidemiology in their lives. So let's define some of these traits and the specified populations that they work with and such. So epidemiologists and healthcare providers are concerned with the occurrence and control of disease. However, healthcare providers are more concerned about the health of individuals, while epidemiologists are more concerned about the collective health of people in the community or population. Now, both epidemiologists and healthcare providers are also concerned with establishing the correct diagnosis. That is important no matter who you are. But the healthcare provider will take the correct diagnosis and use it to focus on treating the individual, while the epidemiologist will use it to focus on identifying the exposure or source that caused it in the first place. Next, we have application. So the application, it normally depends on the scientific method of the study. It is dependent on the epidemiologic judgment, and it's really dependent on experience as well. So for the scientific method, the way you conduct your experiment, the way you ask questions using the 5 W's to get the whole story, that will depend on what you will do. And along with epidemiologic judgment, you use understanding of local conditions in the diagnosis of the community. And experience also counts as well because it's proposing appropriate and practical public health interventions. So without any of these steps, we won't have application. It's saying that, oh, our scientific method, we've gotten data that says we might have an abnormally high number of diseases, and we're going to say it's an epidemic. And because of that, we're going to need to tell the government, and we're going to have to tell them to tell people to start being careful, washing their hands. But we might also say, do we need a vaccine made? Do we already have one that works? And so on and so forth. So now that you know the definitions and broad overview of all those terms, let's take a look at this definition again. So epidemiology, the study of the distribution and determinants of health-related events or states in specified populations, and the application of the study to the control of health problems. Now, once you put that all together, you say, yeah, epidemiology. You're studying the disease, you're studying who gets it, what might cause it, what disease it is in a certain population, and you're using it to apply it for the health of the population. So now that you guys know what it means, let's do some quick review about some of the terms. So here is a page of matching. I'm going to read out each of the different boxes, and you got to tell me whether these match up with distribution, determinants, or application. So I'm going to read it out, and you can pause it after I finish reading it to take a guess at it. If you know the answer, good job. If you don't worry, I'll explain these after. So yeah, let's get started with the first one in this blue box. So compare food histories between persons with Streptococcus food poisoning and those without. So the answer is B, because we are looking at the food histories. And what could the food histories say? Oh, the food histories could be a risk factor, because Streptococcus food poisoning, you can't get it from anything you do. It has to be from something you ate, because, food poisoning. So if you look at the food histories of all these persons, you can say, oh, did someone eat the egg salad? And let's say maybe it's the egg salad that's the risk for food poisoning. And everyone who ate the egg salad got food poisoning and who didn't get it. You can say, oh, so the egg salad was the cause of food poisoning. It was a risk factor. Okay. And number two is this teal one down here. Compare frequency of brain cancer among anatomists with frequency in general population. So the answer here, it could be either A or B. And it's because we do see the word frequency in the general population, and we know frequency means it's part of distribution. And you would be correct. But it could also be a determinant because you're looking at the frequency of brain cancer among anatomists. So you're thinking, does being an anatomist make it a, is being an anatomist a risk factor for brain cancer? And that's something you would find out once you compare this. And the third one, mark on a map the residences of all children born with birth defects within 2 miles of a hazardous waste. That would, of course, be A, because as soon as it says map or anything, you know its distribution. And I have a few more on this page. Once again, same instructions. So the first one says, graph the number of cases of congenital syphilis by year for the country. That would be A, once again, because it said graph. And even though it doesn't say map or anything, it does specify a region for the country. What country is it? Well, it's not specified here, but you know it is one country and not for, say, like a continent or the whole world. But once you do graph these cases, like graph just means plot on a map or like say, oh, these certain regions have a higher cases or this number of regions has this many cases, that would definitely be distribution. Next, recommend that close contacts of a child reported with meningococcal meningitis receive rifampin. So that would be C, application. So what's going on here is that the child already has the disease. You know it, he's been diagnosed or she's been diagnosed, and the only thing you can do after this is to give recommendations of how to deal with it, right? It's the application of using the knowledge that this child has meningitis. So the application would be recommending close contacts, receive this drug, and so on. So the last one is tabulate the frequency of symptoms and laboratory findings among children with chickenpox in NYC. So once again, A, because we're giving a specified region or where, it's New York City. And it also says frequency. So of course, once again, it's distribution. Okay, so that wraps up our class for today. I hope you guys learned something. And be on the lookout for new classes under this topic in the future. And lastly, subscribe. Visit onewordAnchor.org for more free education resources and volunteer opportunities. We're a nonprofit organization that whose goal is to provide these free educational resources. So, of course, thanks for being here and have a wonderful day, guys. See you next time.